this has been such a wonderful morning. We're excited about this program, and I will be co-hosting today with my colleague Nicole Althus. I can't see her; she's there in the back. So, really looking forward. She's the U.S. Ambassador for the Global Health Connector, and this morning we have brought together 3 leaders in women's health that will share their models for setting national priorities and building infrastructure towards women's health. After the 3 presentations, we'll enter discussion on some strategy insights, looking at economic drivers, impact evaluation, and scalability. And so first, we have Ayodola Anise. She's a Senior Director of Operations at Milken Health Institute and the operational lead for the Institute's Women's Health Network, a global collaborative to collate, elevate, and advance existing and new efforts across women's health ecosystem. She brings over 2 decades of experience in advising on and implementing strategy and collaborating for organizational effectiveness, as well as efficiency and equity. Previously, Anise held roles at the Patient-Centered Outcomes Research Institute, or PCORI, Brookings Institution, and the Lewin Group. Her educational background spans English writing, chemistry, and biology, as well as a Master of Health Science from the Johns Hopkins Bloomberg School of Public Health. At this time, let's welcome Ayodola Anise.
Good morning. Oh, I'm going to try that one more time. Good morning. Thank you, Irene, and thank you to the Society for Women's Health and the Global Health Connector for having me with you here today at this event. What a time for us all to be here today. We know that the data show that women's health faces persistent underinvestment in research across many diseases and conditions that impact women uniquely, disproportionately, or differently, with only 4% of research and development dollars going towards women's health. I don't have to continue to share any more statistics with you or share stories because the statistics are in your own work. And the stories are in your lives, your mom's lives, your sister's lives, your daughter's lives. But what I'm here to talk about is how the tides are changing. Investment in women's health used to be measured in millions, leaving behind blind spots in our research and a lack of products and services to address women's unmet needs. But there are opportunities, and there are more opportunities coming to the fray to help us change and shift how we see and think about supporting women. And I'm excited to be here to talk to you about one of them, which is the Milken Institute Women's Health Network. So before I jump into things, I do want to talk just a little bit about the Milken Institute in case you are not familiar with the Milken Institute. We are a nonprofit, nonpartisan, global think tank, and we sit at this really unique intersection of health, finance, and philanthropy. And when you think about the issues that are facing women's health and the solutions, they really sit at that intersection. How do we use philanthropy? How do we use finance to support women's health? At Milken, we address health specifically by taking a look at biomedical research and innovation, public health, including chronic diseases, the role of employers, mental health, and health equity. We also look at healthy longevity and financial security and creating sustainable, equitable, and nutritious food systems. So we work to solve these issues, but we also realize that women's health is a cross-cutting issue. As I mentioned, I'm excited to talk about the Women's Health Network. And often when we talk about the work that we do, we start with our aims and our goals, but I want to start by talking about the people that are powering the Women's Health Network. And so that includes our core staff, it includes our steering committee, it includes our senior advisors, and then it includes, most importantly, our network members. So I want to introduce you to the core team at the Milken Institute. So we are led by Esther Krofa, who is our Executive Vice President for Health. She has a background that spans policy, consulting, and really brings a wealth of expertise to this space. You see my smiling face there. We see Abby Humphreys, who leads our network engagement. We have colleagues Caitlin McLean and Ashley Campany, who are with our Milken Institute Finance. And then we have our team, Brian Carending with Business Development, and Michelle Stevenson and Erica Stratman, who support communications. Continuing with the team that is powering the Women's Health Network, we are chaired, and we have the privilege to be chaired by Dr. Jill Biden. Dr. Biden has really used her platform to bring the right people together, making women's health research and innovation a top government priority. And in 1 year, committed nearly $1 billion in federal funding to support key policy changes and elevating women's health around the world. She is bringing her expertise to be able to help us think about the role of the private sector in supporting women's health. We know that government has a huge role to play, but it cannot and will not alone make up for the research that is needed to take us from research to findings in the lab, to the bedside, to around the corner and the block. And so we're grateful that she's chosen to use her platform at a time like this to help galvanize the private sector. You also see here our steering committee. And we had a press release released last Monday where we announced this amazing group of leaders who are serving in a governing capacity to us, leading and championing our efforts. And they represent the cross-sector of the women's health ecosystem, including life sciences, academia, medical research, business, finance, and advocacy. We are also joined by our senior advisors, Sumera Haque, who is recruiting members from the Middle East and bringing members from around the world. Our network is global, and so we're grateful to have her background and expertise supporting us. Carolee Lee with WHAM, as many of you know, her goals have really inspired us to focus on 3, not 30, being able to support and advance women's health in a short period of time. And she and her team have released several amazing reports that really highlight the business case for supporting women's health. And then Deborah Scherer, who's working to help us recruit new members and also focusing on specific efforts that we will undertake. And of course, the group that is probably most crucial to powering the Women's Health Network are our members. And so we launched in May of this year, released a brief application to identify members, and as of last week, held our very first virtual meeting with over 76 individuals reflecting these organizations. So to date, we have 76 members. Our goal is to get to 200, but this group really reflects enthusiasm across the ecosystem. They have a focus on wanting to advance women's health. They have the skills, knowledge, and the capacity to influence dialogue, but not just influence dialogue, ensure action. And so there is one of my favorite quotes is, if you want to go fast, go alone. If you want to go far, go together. So we're grateful to have this group of members that will be growing coming along with us. I want to just give you a little sense of who these members reflect and represent. And so we have organizations that are very intentionally chosen so that we have balance. We don't want to over-index on any one sector, but really ensure that we have the whole ecosystem that is supporting these efforts. And so as we look to grow to 200, we are going to be paying attention to who is in this group and who makes up this group. And so right now you can see we have about 22% business and innovator, 20% academic research, 16% finance and investor, and 14% advocacy. So we are looking to grow some of the other areas and also ensure that we have global representation, but also representation from other sectors. We're excited to share that together, these 76 organizations have a combined total of almost 1,300 years of experience in women's health. And we have a range of organizations reflected in terms of small, mid-size, and large organizations. Also, the conditions that our members focus on are very diverse. And I should note that many of our network members are working in multiple disease conditions. Given that our aim is to look at and address unmet needs in women's health, we really have a good range of conditions focused. And you will also know that there is a need for us to de-silo some of the challenges and issues that are faced, and by focusing on some of the underlying comorbidities or needs across multiple conditions, we can try to do that. As we have been launching the Women's Health Network, we have been intentional in having conversations. And so we've actually spoken to all of our network members and many others to try to identify what are some of the top critical concerns and barriers that are facing the ecosystem. And so here I have a representation of the top 10 issues that we have heard. And you can also see the number of times that we've heard these issues. While the previous slide shows the various areas and conditions of focus, here we see that the issues that are facing the ecosystem are mostly disease agnostic. And they represent areas where we can change the underlying dynamics of how we do research, how we provide care, how we pay for care, how we develop infrastructure to support the ecosystem. I just want to quickly run through some of them for you, just so that you get a sense of what the areas of needs are and how we believe that the Women's Health Network can help to try to address some of them. The number one concern that was highlighted, which I'm sure you can imagine and are not surprised by this, is the severe public and private underfunding. And so we know that less than 10% of NIH funding is dedicated to women's health, and the funding gaps are really something that need to be addressed so that we can de-risk early to mid-stage innovation. And this is the area that the network will primarily focus. The second top issue is understanding the sex-based differences and breaking down silos from lab to animal models to enrollment in clinical trials. The third issue had to do with siloed research and innovation, which of course leads to duplication of efforts. The fourth issue has to do with limited education and awareness for providers, company leaders, and women in the general public, and that's something that Katie mentioned in her talk. And then the fifth issue has to do with regulatory delays for women-focused technology. Of course, we know if the FDA does not have the information they need to align on endpoints, then it makes it harder for us to get technology through these pathways. So starting from the right to the left, the sixth issue is around fragmented care systems in the healthcare ecosystem. And this is particularly critical for women where we don't see end-to-end whole person care. The seventh has to do with the lack of basic data and information on disease conditions or diagnostics, and there's a need for low-cost diagnostics to use for testing. The eighth issue has to do with gaps across the lifespan, and the ninth has to do with challenges and barriers to coverage and reimbursement, which connects to the fifth issue. And so if we can break down silos, we can ensure that there are the right pathways to coverage. And the final one, which is probably the number one real issue, is the sharing of stories and lived experiences with what we face. Statistics are stories with the tears wiped away, and we need both the statistics and we also need the stories to fuel our drive and passion. So with that, I do want to just talk briefly about the aims of the Women's Health Network, and I'm excited to be sharing this stage with Dr. Deb Loxton and Angela Kaida, who are also doing amazing work in this space. So the main aim of the Women's Health Network is to serve as a global collaborative that will advance existing and new efforts in women's health research and innovation. And I liked the term that was used earlier, collaboration, I think was what it was. And so I, like Katie, I'm going to steal that. But that's really what we aim to do here. So we want to first establish a digital platform. So as we have our network members, we want to give them a place and a space where they can share the resources that they have. Many people have reports, they have registry data, they have resources that they want to share, and lessons that they want to share with others. And so we want to create a platform where all of that is housed in one place. The second piece of this is thinking about the design of an infrastructure for pooled investment funds. The investment funds would be used to support researchers, community organizations, industry partners, and innovators. And we're thinking about this in two ways. One is as a catalytic philanthropic fund, and the other is as a traditional investment fund. We have not released publicly what the size of these funds will be, but we are aiming for them to be quite large, but they will also be disease agnostic and support commercialization and commercially viable organizations. The last aim for our work is to develop projects and activities with deliverables that support the women's health ecosystem. So we know that there are gaps, and we're trying to identify what are the most meaningful wins that we can have that can support the broader ecosystem. And so as we think about this, it will include projects, it will include work groups where we are convening network members to start to work through what the solutions are. And so some of the areas that we are currently thinking about and exploring have to do with, one, regulatory. And so what are the regulatory processes and ways to bridge gaps, including appropriate endpoints to capture outcomes of importance to women, both in pre- and post-approval settings. Another area that we are looking at is coverage and reimbursement, specific considerations for ways Medicare, Medicaid, and commercial payers can evaluate coverage of new products and technologies focused on women's health conditions. And we're also looking at the role of the employer in supporting women's health. Women make up 47% of the workforce, and they spend more on health in terms of out-of-pocket costs. In fact, 21% higher than men. And women make up a huge number of the employer-based coverage in their own name. And so these are areas where we have a high need, and if we can address it, it can lead to meaningful near-term action and impact. So our network members are going to play a critical role in terms of building new relationships to improve the health, well-being, and economic potential of women. They'll be collaborating with other organizations, sharing resources, and amplifying innovations that can address unmet needs. Before I leave the stage, I do want to talk about what is next for us through the Women's Health Network and Milken Institute and our focus on health. In November this year at our Future of Health Summit, which is based in DC, we will be releasing a report that is focused on opportunities for local mammography deployment. We are really excited to be able to release this report. We FOIA'd the FDA for mammography machines across the US so that we could take a look at mammography deserts and pair that with other data for state policymakers. And so we're finding some important evidence that can guide decisions that are made in this area. And then lastly, I just want to highlight some of our upcoming events. As I mentioned, we are a global organization, and so we have events that are taking place all around the world, including Asia, Mexico City. We have our Future of Health Summit, where on November 4th, we will be convening our network members in person. And then across these events, we do have a number of topics that will be featuring women's health, including a session on caring for the whole women, integrating women's health as health, unlocking AI to care for women, investing in women's health, and centering women's health with new technologies. If you are interested in getting involved, there are so many ways that you can do so. Please feel free to reach out to us at Women's Health Network at milkeninstitute.org. I will be here throughout the day, and I would also love to have a conversation with you. With that, I thank you.